Thyroid cancer occurs when abnormal cells begin to grow in the thyroid gland, which is a butterfly-shaped gland located at the base of the neck and is responsible for producing hormones that regulate metabolism. Although thyroid cancer is relatively uncommon and there's multiple types of thyroid cancer, its incidence has been on the rise over the past few decades. Early detection is crucial for successful treatment and for better outcomes. So in this video, I'm going to discuss the warning signs of thyroid cancer that you should never ignore, emphasizing the importance of seeking medical attention if you notice any of these symptoms. One of the most common and easily noticeable warning signs of thyroid cancer is the presence of a lump or swelling in the neck. This lump, also known as a nodule, can be felt by gently pressing on the neck area just below the Adam's apple right here. So it's important to notice that not all thyroid nodules are cancerous. However, if you notice a new lump or swelling in your neck, it's essential to consult a healthcare professional for further evaluation. Thyroid cancer can also cause difficulty swallowing, also known as dysphagia, as the tumor grows and presses on the esophagus. This may result in a feeling of food being stuck in the throat, pain or discomfort while swallowing, or the need to swallow multiple times to clear food from the throat. If you experience persistent difficulty swallowing, definitely seek medical attention. A change in the voice or persistent hoarseness can be a warning sign of thyroid cancer. The thyroid gland is located close to the vocal cords, and a growing tumor can cause pressure on the nerves that control the vocal cords, resulting in voice changes. So if you notice any unexplained or persistent changes in your voice or have prolonged hoarseness, definitely don't ignore it. A persistent cough that is not related to a cold or other respiratory infection can be a warning sign of thyroid cancer. The tumor can irritate the trachea, the windpipe, or the nerves controlling the vocal cords, leading to a dry, non-productive cough, meaning you're not coughing up phlegm. Having pain in the neck or the throat can also be a warning sign of thyroid cancer. So the pain may be localized to the area of the thyroid gland, or it can actually radiate up to the ears. So if you experience this, definitely don't ignore it. Having swollen lymph nodes in the neck can be a sign of thyroid cancer, as the cancer cells can spread to the local lymph nodes. So lymph nodes are small, bean-shaped glands that are part of the immune system, and they help filter out harmful substances. Typically, when lymph nodes are swollen, it's either because of an infection or because of cancer. Usually, when it's due to an infection, the lymph nodes are tender or a little bit painful, but in cancer, they're usually not tender. Although unexplained weight loss can be a symptom of various medical conditions, it can also be a warning sign of thyroid cancer. So if you're losing weight without making any changes to your diet or exercise, or just flat out unexpected, it's definitely concerning. Fatigue or a persistent feeling of tiredness or lack of energy can be caused by a million different things, but thyroid cancer is one of them. Shortness of breath by itself is not going to be a warning sign of thyroid cancer, but if it's associated with the other symptoms that I mentioned in this video, that could also present as part of thyroid cancer. Sometimes thyroid cancer can present with a rapid or irregular heartbeat known as palpitations. If palpitations do occur, it's because of the tumor producing excessive thyroid hormones, which can affect the heart function. The bottom line, recognizing the warning signs of thyroid cancer is essential for early detection and successful treatment. So if you notice any of these warning signs that I mentioned in this video, it's crucial to consult a healthcare professional for further evaluation and appropriate diagnostic testing. Timely diagnosis and treatment can significantly improve the prognosis and reduce the risk of complications. Now, I know a lot of people have questions with these new GLP-1 agonist drugs. So I'm talking about Ozempic, which is also known as semaglutide, and then when it's in its higher dose, it's known as Wegovy. And then there's tirzepatide, also known as Mounjaro. So these drugs, GLP-1 agonists, they're used for type 2 diabetes, and sometimes they're used for weight loss. And there's a black box warning label on the potential for it to cause thyroid cancer. What's interesting is that there's 13 obesity-related cancers, and when you treat the obesity, the risk of these 13 obesity-related cancers goes down, which means that should apply to thyroid cancer because thyroid cancer is an obesity-related cancer. So do these drugs, if they're treating weight loss and they're causing people to lose weight, do they reduce the risk of thyroid cancer or do they increase the risk of thyroid cancer? Well, there's different types of thyroid cancer, and I made a video that specifically looks at this question here, so check it out.